Okay, Faith. No, YouTube. Hello, YouTube. I'm getting ready to go live. Brain health. Get ready to go live now. Hello. It is Medical Monday time. Hopefully, all of you are getting on. We have a wonderful topic on tonight. Um, it's called brain health. Yes. So please get on. I'm simultaneously live streaming on YouTube and Facebook Live. Um, Hopefully, you guys can see me real good and hear me real well. I am really excited about tonight's show. So, as you come on, please like, invite, and share. Please get on and like, invite, and share. I'm trying to get these cameras and stuff going here. I'm trying to get everything set up here. Hey, Essie, thank you for joining on. We're going to be talking about brain health tonight. Please like, invite, and share, please. Um, it is very, very important that you guys get on and share tonight's show. Hey, Tawana Knowles. Hey, Jacqueline. Please like, invite, and share as you guys come on. Please do that for me. I'm trying. I think I have too much ceiling again, but I don't know what to do about it. And so she's the director. She needs to come and fix my cameras before I get started. How about that? Ha ha ha. Since I paid all that money for school. Yes, buddy. Okay, I think this is the best I'm gonna get. Hey, Auntie Brown, thank you for joining on. Please invite, share, like, invite, and share. We're gonna be talking about brain health tonight. This is gonna be a very, very important topic. I am Dr. Grace Patterson, affectionately known as Dr. Grace. I live in the Metro Detroit area. I am a native Detroiter, born and reared in the city of Detroit all my life. Did all my education, educational training here in the city of Detroit. Can anything come good from Detroit? I should hope so. A little bit background. I think I've told you guys that I was a teen mom and I was able to finish high school, college, medical school, residency, and throughout my career and establish my own business right now as a single parent. And hey, Doris Ease, and to God be the glory on that. I told the Lord if He ever let me make it, I will always tell Him without Him, I would not have been able to do it. And I'm absolutely elated and excited to be able to give Him all the glory in regards to that. So as you guys come on, hey, Doris, please like, invite, and share. We're going to be talking about brain health tonight. This is so, so important. In my research and my study, I have such a wealth of information that I have found out in regards to this topic on tonight, and hopefully this will bless you. Please, if you are a pastor or know a pastor or any prelates, bishops, or whatever the case may be, please get them on this show tonight because we're going to be talking about mental health and how it affects and you dealing with some of your parishioners with inside of your place of worship. So it's very, very important. I have, oh, thank you, Denise. Hopefully, thumbs up is that you're saying that my background is good. We're going to be talking about mental health and brain health. There, mental health, brain health, and the mind. We're going to be talking about all that tonight. It all kind of like goes together. Hey, Jonah, thank you for joining on. Please like, invite, and share. This is a very, very dear topic to my heart. Again, I'm Dr. Grace Patterson, the Metro Detroit area, commonly known as Dr. Grace. I'm managing owner of Bethesda Holistic Center and Everything New Anti-Aging, Rejuvenation, Integrative Medicine, Concierge Services. We also provide, hey, Brother Green, thank you for joining on. Please like, invite, and share as you guys come on. Out of the mouth of the famous prophet Fred, when he gets on, he says, do your daily evangelism, share. Please do that. It would be very, very important because we got to get this message out there in regards to mental health wellness. So let me tell you a little bit. A reason why I decided to do this topic was two reasons. And it's amazing how God orchestrates things. So I had an incident this, hey Bishop, thank you for joining on. Please like, invite, and share, please. If you know any other bishops, apostles, or pastors, evangelists, prophets, or teachers, please get them on tonight because we're going to be talking about brain health from not only from a medical perspective, but from a spiritual perspective. Hey Deborah, thank you for joining on. Please like, invite, and share. I had a situation. I'm going to give you guys the reason why I decided to do this. Two reasons. Um, I had no idea that May was Mental Health Awareness Month, but God knew. Hey, Renita, thank you for joining on. Thank you. Please like, invite, and share because I had a situation that was up close and personal for me this month dealing with someone that has a mental illness. And it was like, whoa. And so it was like, okay. And so when does the natural physical stop part start and end? And where does it pick up in the spirit? And how does that happen? So when I had that personal experience, hey Latrice, thank you for joining on. When I had that personal experience, I got in the face of the Lord and I was like, explain to me what just happened. And I began to not only seek the word, seek his face, seek guidance, but I also began to do some research and reading on my own. So it is May, a mental health awareness month, and it was kind of funny. I was getting all these emails about. It makes sense now. Getting emails that they have it. May has been designated Mental Health Awareness Month since 1949. So it is very, very important that we talk about this subject, especially in the African American community or people of color. This is something that we normally not normally don't want to talk about, but everyone has one in the family and no one really wants to talk about it. Years ago there used to be what they call insane asylums and the crazy house, the nut house. It was always these labels, these bad stigmas with mental health, because I'm going to stay on the positive side of this as I go through this. And here in the state of Michigan, one of our governors came in and shut off all the funding and closed down all the mental health facilities that were state funded. And then all these people that had mental health issues were just homeless people on the street. But anyway, that's a whole nother story. But anyway, let's talk about this on tonight. It is very, very something near and dear to my heart, and I had something happen to me. Um, and I'm going to give you a brief synopsis of what happened to me. Hey, Susan. Hey, Latrice. Hey, Mazine. We all have someone in our family, close friend, loved one, someone that we know that something is not right with their mental faculties, and and we have to deal with that person on a whole. It could be a myriad of things. Hey Latanya, Tanya, thank you for joining on, sis. Please like, invite, and share as you come on. We have family members that we may have to deal with them on a sense of not being fully mature or developed, or the age that they're in as they stay in a small childlike state. You might have people that have situations where they can be violent. We can have people that hear voices. I mean, mental health or the lack thereof can come in many shapes and forms. And sometimes we are dealing with high functioning people that have giftings and can operate and can work, but then there's just something that's just not quite right, but the thing of the matter of it, we need to have a conversation, we need to have a dialogue, we need to understand that it is a disease. So just like diabetes or high blood pressure, diabetes is dealing with the pancreas, that helps digest the food. High blood pressure is dealing with the heart and the blood vessels. Mental health deals with the brain, which is encased in our head. But I think the stigma, or the stigma that comes along with that, because you can interact with someone that has diabetes or whatever, but they're able to function mentally. Hey, Kim Cole, thank you for joining. Please like, invite, and share. Unless they're having a hypotensive situation where they become delusional, or become delusional, or what's the other word? They become delusional, or whatever because their sugars are too low. Hey, Linnell. So, but that's really not mental illness. It's just, it's the fact of the matter that the sugar is too low. The brain thrives on sugar to function on sugar. So when the sugar is too low, the person may become a little have a hypotensive episode where they become a little delusional and may. This person said that I hurt their feelings, and I remember the conversation vividly. It's all about perception. It's the point today. Your makeup is good. You smell good. You look good today. You're looking very good today. So, hey, Sister Maria. And at the same time, this happened in church. This happened in the house of worship. And Apostle was talking about hygiene at the moment. And the person took it as that I was talking about, this is what they said. He was not even talking about that. He was talking about sin. I don't understand where you get that from. So in my head, I'm like, this is not making any type of sense. But guess what? I didn't want to argue. It says agree with your adversary quickly. So what I said I said, it's clear that hurt your feelings. I said, you know what? That was not the motive and intent of my heart. Please forgive me. So they wanted to go, they started escalating. And I was like, where is this coming from? Where is this going? And I was like, you know what? Let's stop. Hey, Cheryl and Teresa and Liberia Cole, thank you for joining in, like and share. So I was like, where is this going? I said, but you know what we're not going to do? We're not going to go back and forth. I apologize, and I don't know what else you want me to do. So then they go on saying, you church folks, and you don't listen to people, don't want to listen to me. And mind you, before all this happened, this person was talking for 30 minutes, and I was being a sister in the Lord listening to this person vent for 30 minutes. So I was like, wait, you know what? I just listened to you talk for 30 minutes. I don't know where this is going. I apologize. I said, so let's pray. So when I began to pray, this person walked away and locked themselves in the bathroom. So I was like, okay, so now it's not just a mental thing, it's a spiritual thing. But anyway, just follow me with the story here. So I was like, okay, I don't know what to do now, but it's all good. Let me just, just keep it moving. So I began to say, Lord, what is going on? What is this that I'm dealing with? And so, and this ranting and this raging thing that this person was going through, they told me some things that happened in their childhood. And I mean, it was just all over the place. And I was like, okay, Lord, what is going on here? So the Lord told me specifically what I was dealing with, what type of spirit I was dealing with. And I was like, okay, Lord, show me in the word, and also show me medically, how am I supposed to deal with this and what is going on here? So this was my third time seeing this. Okay, my third time seeing this. So let me tell you this. He said that I was dealing with a skillful liar and that I was dealing with a baitful manipulator. And I said, baitful? I said, Lord, I've been in school a whole lot of years and I never heard that word before. I can kind of figure out what it means, like baiting someone, baitful. So I was like, let me Google it. So when I put that word baitful in the Google search, a demon picture popped up, and I was like, Lord, oh, have mercy. But anyway, so I was like, okay, so Lord, explain to me what this is. He said this person is under demonic influence, and what they do is they bait people in based upon the crises that happen in their lives. So if you're a pastor under the sound of my voice and you're dealing with people that, like I said, this is my third time seeing this. What they do is they tell you some traumatic events that has happened in their lives, maybe years ago or even as a child. So they bait you in with compassion and that this person has been through a lot. So when they go throughout ministry or go throughout dealing with people remember, they don't let you forget it either because they talk about it all the time. I've been raped or I've been molested or this happened to me. And they talk about it all the time. So other things, people, things, and events. So I was like, Lord, I did a study on witchcraft. Most people think of incantation and chanting and all that. That is a part of it. And then you think about Halloween, the big old hat the green face, the bump on the nose, and stirring pot and sand stuff. That's really not it. But if you look up the definition of witchcraft, follow me. I'm talking about mental health here. You're going to follow me. I'm starting from the spiritual side because everything starts in the spirit first and then it manifests in the natural. So, definition of witchcraft is they are addicted to those chemicals that are being released. As a lot of people, you know how people say people love drama? That is a true statement. They love drama. They're addicted to that chemical and hormones. But guess what? Like I said, the oxytocin, that's the love hormone that can be monitored, or the good feel hormones, the serotonins, and all of those can be actually tested and documented physically when someone's is in a good place and in high praise and worship and meditation. So there is also a dark side. So that person always talks about that a bad thing that happened to them, and they can be graphic about it, because what happens, the more graphic they are about it, the more those chemicals are released. And guess what? That's a gateway for the enemy to come in. So that's how that happens on the spiritual side. Okay, so, and you see how I'm traveling with you to the mental side. Okay, so as far as the mental health and the physical side of it, so there are chemical imbalances that happens with brain, with maintaining or mental health awareness. Okay, so it can be hormonal. It can also be what we call neurotransmitters, and I'm going to talk about that right now. Let me neurotransmitters. You guys heard me talk about that at excuse me, in great detail about it at Bethesda Holistic Synergy, because we actually do testing for neurotransmitters. So that is like your serotonin levels, your dopamine levels, all of your cortisol levels, your norepinephrine, epinephrine, all of those have to be in a state or a level for a person to operate in a good mental capacity, along with as a overall health. So when they are off, that's where you get mental illness and disease. Now, in my study, there are different type of things that can happen to the brain. So we talked about the chemical and at the cellular level. Now, let me say this right quick, and then you'll see where I'm going. Hey, Phyllis, thank you for drawing on. There are the neurons that are in the brain, also are neurons that are the same neurons that are found in the gut. And I'm going to connect the two in a minute. So, and remember the story that I told you a little bit earlier, because that person was drinking a whole bunch of stuff because they had stomach problems. The person that was all over the place in the beginning story, they was drinking all this stuff because they had stomach problems. It has been scientifically proven people that have mental challenges or mental disease or brain disease also have something going on in their gut, because the same makeup or the same neurons that are found in the brain can be found in the gut. Okay, so and let me tell you this, you know how they say you have a gut feeling, or you just know it, or whatever the case may be, or you kiss somebody you love, you get butterflies, or whatever the case may be. There are actually neuron transmitters, the same transmitters that the brain can release, also can be found in the gut. So just stay with me for a minute on there, and I'm gonna make the connection here. We're talking about brain health. What diseases that can affect the brain? Congenital abnormalities, that means that a person can be born with something wrong with their brain. It's just something that happens during the maturation process, when the baby is being developed and the brain doesn't develop like it should. So they have cognitive inabilities to effectively communicate, hormonal imbalances. Yeah, let's talk about this for a minute too. We always talk about menopause. Men, it has been scientifically proven, as they get a certain age, they go through these hormonal changes, and due to the fact that our food have been chemically modified or chemically injected with certain foods and stuff like that, men are getting hormones that they should not get. So it can cause brain fog and problems with thinking. And let's even talk about teenagers for a minute. It just seems like when they become a teen, you know how mom used to say they smelling they self or whatever. There is a chemical process that is happening and things of that nature. It can affect their behavior and how they act out or don't act, or a young lady that's going to pubescence or puberty, or about to start her menses, those hormones and things, That is true. Okay. So all of that plays a role in the mental health and how a person react, or brain health, I should say. Let's talk about trauma. Yes, car accidents, blunt trauma, someone being hit on top of the head, car accidents, falls, people, all those things can affect a person's thinking and cognitive and their behavior. You've heard of post-traumatic syndrome. They had a traumatic event, and those chemicals have been abruptly changed, and when they come back, they don't know how to adapt or change because they relive that situation over and over again. It's called imprinting. It's called imprinting on the brain, or even imprinting on the soul. So even traumatic events of people feelings being hurt from relationships, or words that have been spoken over them. We used to say when we were little, stick and stones may break my bones, but words will never hurt me. That is not true. Words can hurt and can be damaging, and people can take that into their adulthood, and it can affect the way that they interact with people, which is a cognitive and has to deal with your mental status and your brain health. So yes, you have to be careful how you speak over your children. You have to be careful the conversations that you have on a day-to-day basis. You have to be careful how you speak over yourself and how you respond to certain things, because it can affect. Remember, we talked about that. There's over 60,000 thoughts a day. 85% of them are what? Negative. 95% of them are repetitive. So you have to make sure that you're careful in regards to how you think and all of that. Also, negative visual and auditory exposures. You got to be careful what you lit in those eye gates and what you listen to all the time. Okay, you got to be careful with certain types of music. You got to be certain with certain type of movies. From let's just be real about it. Let's go there. Pornography. Let's talk about I'm an action packed girl. I like blow them up and all that other kind of stuff. But you gotta monitor that too. You gotta make sure that you're not letting all that violence infiltrate your mind and your spirit and in your ear gates and stuff. When I go on a fast or whatever, I'm not watching that TV. I fast from TV, and most oftentimes I fast from my action packed movies too. So you got to be careful. You can't let that stuff indoctrinate and imprint in your mind, because those are the chemicals that can be released. And if they're bad chemicals, we talked about that before, is a breeding ground for disease. So your mind is very key in that. Okay. Let's talk about abnormal electrical firing, which of the brain, which is known as seizures. There's different type of seizures. There's grand mal seizures where the body totally shakes. There are petit mals where it's just one part of the body, or absent seizures where a person just goes on to staring. All of these are due to electrical impulses of the brain. The brain is part of the body, is an organ part of the body. And sometimes people that do have seizures have personality challenges, or personality disorders or mood disorders, because the electrical impulses or the firing of the brain is not doing what it's supposed to do. And if the electrical impulses are not doing what they're supposed to do, therefore, that means the chemical levels are not where they need to be. So that's how anti-seizure medication works. It works at the level of trying to get whatever is lacking, they're trying to make up for it. So I told you there's two reasons why I did this. One was because I dealt with a person up close and personal, that had a mental challenge. And the second reason why I did it is because when I went away to do I go to classes to keep up on things. They had this test that you can do on your patients, where it's like this little helmet, and you connect it to a computer, and it tells you what your brain functioning is, the chemical levels, the chemical balance, and it tells you how healthy your brain is. So we as a practice are looking into investing in that equipment. So, but before we do that, how many of you out there, I want you to respond in the comment section, even those of you that are on now that are coming on. Hey, Marvin, those of you that are coming on, how much money would you pay to have that test done? If you can tell whether or not you might be going down the road of, if you might be going down the road of dementia or Alzheimer's disease or some other type of brain ailment, how much money would you pay for a test to be able to tell you that? We're not talking about an MRI. We're not talking about a CT scan. All radiation. This right here is all natural. It actually picks up on your own brain waves. So I want you guys to put in the comment section how much you think or how much you would be willing to pay for such a test. And then once we get those numbers and get those values, we can show you what you can do dietary wise. We can tell you what you need to do detox wise. We can tell you what you need to do supplement wise to keep your brain healthy. Oh, thank you, Auntie Brown and Deanna, $200. You know, that's the ballpark area that I recommend that we charge our clients or slash patients for it. $200. Okay. All right. And then because you can't put a price tag on you. Now, I want to go back to the spiritual side of it right now. I want you to think about this right now, this very moment. If the enemy takes your mind, he has everything. Think about that for a minute. If the enemy takes your mind, if you don't have your mental health, if you don't have your cognitive ability of your brain, it's over. Think about that. But anyway, let me keep on going. There's different type of brain testing out there. I just talked about it: MRI, CT scans, EEG, which tests the brain waves. The one that we're talking about is called WABI. So we're thinking about incorporating that in our practice. So years ago, they used to do ECT, electronic brain stimulus. They used to actually give people electric shock that had mental disorders to try, because they knew that there was some type of brain wave disconnect. So they used to do electric shock therapy. It's called ECT. But it was so brutal and so barbaric, you know, they stopped doing it. But they did have some success in some situation. Medication, there's homeopathic medication and stuff like that. So let me tell you something too, what I found out in my study. Remember I told you about that the brain is connected to the gut, and you can find the same neurons in the brain that you can find in the gut. So most oftentimes people that have any type of mental disorder have a gut disorder, and I'm going to talk about a couple of those in a minute. I'm going to talk about it right now. There is a classic. I'm gonna use this disease as an example: hypothyroidism, where the thyroid is not working where it's supposed to be, is working at a low rate. So when metabolism is low, a person tends to gain weight. And if a person tends to gain weight, they kind of become slow, tired, and sluggish, because the thyroid is regulating the metabolism of the body and the energy of the body. So the person becomes a little tired. A person can lose hair. You know, half their eyebrow is gone. They could start thinning up here. And they said one of the things that they say too, that person becomes constipated, and they cold all the time because metabolism is low. So let me tell you something. What I did in my research and in my study, and they are depressed. So how does depression go along with low thyroid? And I'm going to tell you and make the connection right now. In my studying and in my reading and in my research, serotonin, which is the feel good hormone. Like, so if a person is on Prozac, Zoloft, Seroquel, and some of the antidepressants that are out there, the goal is to get the serotonin levels up. So if the serotonin levels are up, the person's mood is elevated and they tend to be less depressed. Guess where 90% of the serotonin levels are made? Anyone want to take a guess? Anyone want to take a guess? Can we get some? I want y'all to interact with me. Do you know where your serotonin levels are made? Hey, Jamie, thank you for joining on. Please like, invite, and share. Take a guess. Now we're talking about brain health here, and I want you to guys to, yes, it's in the gut. 95% of it is made in your gut. So hey, no, Lanita is not in the brain. It's in the gut. So I know this is going to be a little graphic or whatever the case may be. You know, sometimes you can go to the bathroom and after you do number two, you feel happy. And that's because those serotonin levels are being released because you're cleaning out that area. So your gut is not only the center for your immune system, but it's also the station for your mood and for your mental health because they are connected. So it is very, very important that you guys understand that and realize that. That's why I told you guys we're going to make this thing. And guess what? It is called, where is my, I got to click on this. Where did my, let me see. Give me a second, guys. I had my reading that I wanted to get up here that I wanted to read to you guys. I had my, hey, what happened? Hold on, guys. I wanted something. Here we go. So it is called, when the brain is connected to your gut, it is actually called, there's a name for it. It is called, let me see here. Toolkit. I just had it. Give me 1 second, guys. Give me a second, but I just want to tell you guys this. The reason why your chemicals in your body have to be balanced because there is good bacteria in the gut and bad bacteria in the gut. You want to have good bacteria in your gut because it helps regulate your immune system and your mood. So the chemicals in the body that are called neurotransmitters that are secreted by the neurons that's in the stomach and the brain help regulate all of that. So if your brain is not healthy, so the gut is not healthy. So the bacteria in the gut are not healthy. So they did some research and found out that the neurotransmitter levels that are in the body help regulate and influence the bacteria in the gut. So most people that have mental health challenges or not a healthy brain don't have a healthy gut. So if you are a healthcare provider under the sound of my voice or a mental health provider, you probably already know this. Not only should you be treating the person's brain, you need to be treating the patient's gut. And you should. So that is very, very important why you need to detox. I also did some study on, I talk about fasting all the time, but I also did extensive studying on the medical benefits of fasting. There are in certain countries, not in the United States, but in certain other countries where they actually implement and incorporate fasting for the treatment of high blood pressure. They use fasting for the treating of diabetes. They use fasting for treating of mental disease. They actually have wards where they're called fasting wards, where people actually come in and check themselves into the hospital, and they actually stay from anywhere from 7 to 21 days on fast. And with the fact they found out, they even did, I just saw one documentary where one gentleman where he just stopped talking and he was hearing voices, and matter of fact, he had a diagnosis of schizophrenia. So they put him on a 21-day fast. And they said by day 7, they can actually, he was not talking, he was not interacting with anyone. But anyway, at the end of that 21-day fast, he was communicating, he was talking, and he was able to able to work. So, and then there were certain situations or certain other diseases, especially high blood pressure and stuff like that. And while they were fasting, they were drinking water and they were exercising. And the point of the exercising was to burn up the toxins that are being released during the fast. So, mental health, that's brain health, what we're talking about tonight. Fasting is very, very good for the brain. So, this is what they found out. They also said there are 3 types of energy in the body that the body uses while you're fasting. The first thing to go is the sugar. The body uses the sugar right away. By the 3rd day, they call that the ketogenic state, where the body is now is using up this energy. Your brain loves sugar. So your brain used the sugar up first. The second thing that the body use is protein, and also the body use what they call lipoic acid, which is found in adipose tissue. So the body really burns up the fat, and you don't have to worry about losing muscle mass, because during a 21-day fast, the body only uses 4% of protein during that fast. Most of it is sugar and most of it is fat. But in that 21 day of fasting, and mind you, in these other countries, the doctors are actually monitoring the people as they go through this fast. When they're monitoring them, it resets everything. So it resets the blood pressure, it resets the hormones, it resets everything. Now, this is what I want you guys to know in my research, what I found out. And I talk about this all the time, that we are so far removed from the way God had created and designed everything about us being in nature and connected to the earth, that we should be able to walk up to a tree and eat. We should be able to go to a garden and eat. We should be able to slaughter our own animals that we grow ourselves, that are not injected with hormones and antibiotics and steroids, and eat it, okay? We should be able to put our feet in the grass and on the ground. We're not supposed to have shoes on all the time. It's called being grounded, because there's energy that God has put in the earth, because we are from the earth, right? He created man from the dust of the ground, and then he breathed life into him, and man became a living being. So we need to be connected to the earth, but we have shoes on all the time. And then we holler at our children when they want to take their shoes off, and they can't be running around outside without shoes, and we don't want to be running around without our shoes. But believe it or not, that's how it was supposed to be. But anyway, follow me. You know, I like to go down the street around the corner and bring you back again. So we are, the way we are living now, remember, I always say things to our convenience may not always be to our benefit. We were not created to eat all the time. Let me say that again. We were never designed to be able to have a a refrigerator full of food and be able to eat whenever we want, however we want it, want it all the time. That was not how that was supposed to be. So our bodies are suffering the brunt of that. So that's why, especially in the United States, we have 1 in 4 people are obese. 1 in 4. So you can count there, 1, 2, 3, 4. 1 in 4 people in the United States are obese. We have the highest rate of high blood pressure. We have the highest rate of diabetes, and even in teen and adolescents now, that those numbers are going higher and higher and higher, because of the processed foods that we have available to us that we should not be eating. Anything that is packaged out of a can, pizza all the time, you know, all those things that are convenience and fast food. That is not how we were created to live. And so the body is suffering as a result of it. And even the brain, we have never seen, well, I haven't never seen, well, I've been a doctor for 20 years now, but the amount of Alzheimer's disease and dementia, because when we were in medical school, I'll never forget this, they said by the year 2013 that 80 to 85% of the U.S. population will be over the age of 65. And here we are. But there is so much overwhelming of people that have dementia, that have Alzheimer's dementia or vascular dementia or what we call mixed dementia is because of what we put in here. What we put in our mouth is affecting our brains. Okay. So, I mean, I don't know. I don't know how else to say this, but let your food be your medicine. So I've been seeing a documentary about a person that had MS, which was an internal medicine doctor. She was in a wheelchair and was in a wheelchair, almost being bedridden. She was like, I need to apply. And she had a degree in nutrition, so she decided to put to practice what she knew. So now she's doing bike marathons. But anyway, but before that, she was on medication and was bedbound. So, and the only thing that she changed was the choices of the food that she would eat. So, we're talking about brain health here. So, it needs to start with you saying, hey, I want to have a healthy brain. I'm going to do whatever is necessary to do that, to have a healthy brain. So, the rest of me can be healthy too. So, you guys can see how each and every one of my teachings of Medical Monday builds on top of each other. Okay, it all is connected from the spirit, the best you from the inside out. You got to make sure that you understand the spiritual side of it, where the spiritual end starts, where it ends, and how it affects people in the natural. So please be mindful of when you're dealing with people in the house of worship. The anointing draws good and evil. The anointing draws people that have, mental, not healthy brains. Okay, let's just call it what it is. They have chemical imbalance. They have hormone imbalances, and you have to understand the difference. And then, believe it or not, sometimes those mental instabilities and things of that nature can be an open door, a gateway to something bad and to something evil, just like the gateway of being in the presence of the Lord and praise and worship and feeling the power of God and being under the anointing and feeling his presence can be something good, right? So if you can feel the presence and the power of God, there is a side that is not good. Now, listen to what I'm saying. I'm not saying for you to shun those people that come into the house of God because they need to be there, because they need to be under the anointing. They need to experience the power of God. They need to be there. After we prayed, fasted, and laid hands, I'm a firm believer. Sometimes you may need a pill. Let me say that again. You may need a pill to get those things balanced, okay? Or come to Bethesda Holistic Center so we can get those things balanced, so we can get your gut in order, so we can get those neurotransmitters balanced. If you are a psychiatrist or psychologist or anyone that's in the mental health field, you got to remember we most oftentimes we take a history, we give a diagnosis, and we give a medication. We never check the neurotransmitter levels because there's not available traditionally in traditional medicine. We may, so an alternative, which I also think that all people should do, even if a person, they need to have their dopamine levels checked. They need to have their norepinephrine checked. They need to take their serotonin levels checked because there is what we call a serotogenic effect that can cause a disease where a person can have too much serotonin, and that's not good either. So, but most oftentimes the medical profession and the mental health profession just blindly give this medication with never actually checking the serotonin levels, which I feel this is a very disservice not to the provider, which is a disservice to the patient, and of course, insurance companies don't pay for it. But it should be part of the overall care of the person. But at Bethesda Holistic Center, we provide neurotransmitter testing to see where your brain is in regards to your brain health. Okay, and again, I think we're going to get that piece of equipment called the YV so we can see where the brain, the actual health of the brain is. So for those of you that are interested in having that test done, we would love to take your name and I'll let you know when we are providing that test. And like I said, it tells you the state and the health of your brain. It's like an EKG of your heart. You know how they put the leads on you to see the health of your heart, to see if there's any blockages, to see if there is what they call electron, because the EKG of the heart checks the electrical stimulus of the heart to see how it beats and all that other kind of stuff. So if there's something off, the EKG can pick it up, the echo can pick it up. So it's the same process with the brain. The only thing that they provide from allopathic medicine, traditional medicine, is a CT scan and an MRI or an EEG, but they don't tell you at the level of the neurotransmitter what is off. Okay, they don't tell you at the level of the gut what is off. So if you're interested, there's a link right there that's being posted right now to click on and set a time aside to talk to me about what I'm talking about tonight. It is Mental Health Awareness Month in the month of May. um, Believe me when I say this to you, there are so many people that are under the sound of my voice that know someone that has some health challenges in their brain, and it's a disease like any other disease. Like I said, high blood pressure, sugar, diabetes, problems with your person may have a problem with their eyes or with their feet or their joints. You know, our body is our bodies. Okay, so let's take the stigma off mental health. Okay, let's take it off. Let's take it off. Let's have a dialogue. Let's talk about it. You know, let's not just be whispering about it. That's just sister so and so or brother so and so, or that's just how they are. No, they need some help. Now, mind you, they have to want the help, because some people that have mental challenges, hey Dion, thank you for joining on. Some of people that have mental challenges don't think anything is wrong with them, okay? It is what it is. So some of them out there. But then there are some people out there that know something is not right and they want help. That's who we're talking about. At the same time, let's talk about this for a minute. Out of all the shootings that have been happening within the last years, the mass shootings and all that other kind of stuff, is someone, it has something to do with somebody with a mental illness, a mental problem, a mental disease. I didn't, you know, he was quiet, he didn't say much, but people close knew something was going on. Some of them was in the military, had dishonorable discharges because of mental health, and they have documentation of their mental health illnesses or whatever the case may be. So this is a serious issue. We can no longer let it be go on talked about or not talked about. We have to have dialogue, and we have the tools to do something about it, from a traditional medical side and a alternative medical side. So please like and share this video. For you replayers out there, thank you for tuning in and taking the time out to listen to this video, because it is serious. It's something that can be treated, it's treatable, and it's something that can be helped, okay, from a natural perspective, and from eating right, eating the right foods. How about just drinking some water? You can be dehydrated, okay? You can be dehydrated and it can cause brain fog, okay? When you can be dehydrated, it can cause a person not to be able to think right or to think clearly. You know, you can hallucinate being very dehydrated, okay? You've seen the movies where people are in the desert and they see mirages and the heat be so high, they seeing stuff because they dehydrated. I had a gentleman who had brought me his mother, and he was talking about, my mother is hallucinating, and I'm like, your mother is dehydrated, how about giving her some water? I mean, and the reason being is, most oftentimes seniors, listen to what I'm saying to you. So for those of you under the sound of my voice who take care of seniors, a lot of them don't like drinking a lot of water, because a lot of them don't like going to the bathroom. I mean, it could be a taxing effort for them to get up out of the chair to go to the bathroom, or to sit on the toilet and get up from the toilet. So make sure, if you have a senior or someone that has joint problems or whatever the case may be, they have the raised seat and things of that nature. And a lot of them don't like giving their people, some caregivers do not like giving their elderly family members water, because some of them are in diapers and they figure the more water I give them, the more they pee, the more I have to change their diapers. But all at the same time, you're killing them, because you're creating dehydration. So if you, I know I'm saying a lot. All of this goes to help because the brain of dehydration not only cooks the organs of the body, but it cooks the brain. If the body doesn't have the right nutrients, a lot of people that I see that say that their parents are have dementia, a lot of them are malnourished. There is a situation where they're not getting enough protein, they're not getting enough the right complex sugars that they need for their brains to operate effectively. Some of them are on 10, 11, 17 medications, and they're all interacting with one another, causing problems with the brain, causing problems with cognition because too many medications. And I've talked about that before. We at Bethesda Holistic Center, we pay attention maybe that I've had phone calls when people come from the hospital and for whatever reason the doctors in the hospital may take them off something, add something on, and the family wanted fill, and then I get a call from the office and say, Dr. Patterson, we're trying to fill this medication, but there's a flag popping up saying that there's an interaction. What do you want us to do? So all these things are significant. All these things are important in regards to having a healthy brain. Yes, a healthy brain is very, very important that you do that. And I've talked about just being quiet, just sitting somewhere and being quiet. No cell phone, okay? No television. Can you just be quiet? Yes. Another thing that I'm going to start incorporating this week, you got to remember that your electronics, your cell phone, your iPad, your tablets are like small electric towers, like phone towers. They emit radiation, they emit some type of waves. We should not be sleeping with our phones in our rooms. We should not be sleeping with our phones close to our beds. The phone should not be the last things that we look at before we go to sleep, because the light from the phone that goes into the eye gate throws off your melatonin. Yes, it does. So when it throws off your melatonin is what causes you to relax and be to shoot and allows you to go to sleep. So you should not be looking at your phone and then trying to go to sleep and you tossing and turning and wondering why you can't go to sleep right away, is because you just got finished throwing your melatonin off. Also, those of you under the sound of my voice say, I can't go to sleep unless my TV on. Okay, do me a favor. You have a timer on your TV. Hopefully you have one of the up-to-date TVs. Put a timer on your TV. Let it be on and then let it cut off, because you should not have that stimulus going the whole time that you're sleeping. Okay, you should not have that stimulus of your TV going the whole time you're sleeping, because your spirit man, your subconscious man, because you are a spirit being having a human experience. Your spirit never goes to sleep. So you should not, your subconscious should not have the TV speaking to it while you're sleeping, because you don't know what's being said on TV. You don't know if it's, positive, negative, whatever the case may be. That should not be happening while you're sleeping. Okay. Food commercials, fast food commercials, and all that other kind of stuff should not be going into your subconscious, because whatever goes into your subconscious, you wake up in the morning and carry it out. Okay, or sometime or another. So you should not be sleeping with your TVs on, okay, or anything like that, unless I'm a great component of good positive music. If that's something that you want to do, classical music, praise and worship music, positive confessions. Sometimes I do sleep at night with my word playing, because it's speaking to my spiritual man. And it's good sleep for me. I wake up refreshed and I'm ready to go. Those are the type of things to me are okay, but sometimes you just need to go to sleep in the dark with nothing playing. You just need to take a rest. You need those brain waves to, you need to go through all the phases of sleep to have good sleep. And I talked about that in one of my Medical Monday is about the appropriate sleep. So hopefully this helped you. Those of you that are under the sound of my voice, we talked about brain health. We talked about the mind and other videos. So as a man thinketh, so is he. We talked about all of that. We talked about there's a difference between your brain and your mind. Let me talk about that for this last minute. It's 9 o'clock. Your brain is the actual organ. The mind is actually how you function, how you operate. It is your subconscious that allows you to be who you are. So there are two separate things. So your brain has to be healthy in order for you to carry out what you need to do every day, and to carry out whatever God has given you, your assignment. So remember this, if you may remember nothing else, that if the enemy gets your mind, he has everything. So if God has your mind, you can do anything, right? So please, I appreciate you guys for tuning in. Please share this video. Share, 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 share. Share this video, please. Brain health is very, very important to everything that we say and do. Your attitude, your behavior, everything is focused and centered around having a healthy brain. So May is Mental Health Awareness Month, and please share this video. Please, if you could talk to somebody that you know that is having some issues and they can receive from you, talk to them. Okay, you can see the signs and symptoms. Okay, you can. And be led of the Lord to talk to them, and especially if they come into you and to confide in you about some things, and they're opening up to you. And be mindful of the fact of the signs and symptoms, what I talked about earlier on. For those of you replayers or people that are coming in right now, you're going to have to catch the beginning of the video to do that. Please share this information. It will help you personally, professionally, pastorally, especially in the house of worship, especially in the kingdom of God, okay? Because he said, be ye not conformed to, be transformed by the renewing of your mind. Yes, there's a reason why that scripture is there. Yes, we have to renew our mind. Yes, listen to this. Our weapons are not accountable, mighty to pulling down the stronghold, casting down every vain imagination, exalts itself against the knowledge of God. What is imagination? Your mind. So we have to renew that to be what we need to be, not only to ourselves, but to those who we love. So thank you so much. I am Dr. Grace, managing owner of Bethesda Holistic Center and Everything New. Thank you for tuning in to Medical Monday. Hopefully this was a blessing to you. I am also on YouTube. Please look up Medical Monday, Grace Patterson. Thank you so much for tuning in. Grace and peace. God bless, and bye for now.